Welcome to the Undiluted Corner, where truth is our refrain. Relationships, health, and wealth, we're breaking every chain. Grab a seat, join the talk. In this corner, we unite. The Undiluted Corner, where we shed the light in the Undiluted Corner. We explore the three relationships, health and wealth. Set the spirits free, tune and turn up. Let's embark on this ride, the Undiluted Corner, where perspectives coincide. From love to grace to health, we grace and wealth in every form. In the Undiluted Corner, authenticity is the norm. We'll laugh, we'll learn, we'll share it all. In this lively space, join the conversation. Let's make life's journey a thrill and chase. This is the Undiluted Corner. Raw truth, real conversations.
Welcome to the Undiluted Corner. This is the 9th episode, and on this episode we are going to raise the dead. We're talking about erectile dysfunction. Some men are uncomfortable with it, some are comfortable with it. But before we even go further, I have to acknowledge my erudite co-host, Andy.
Blessings.
Wagwan, Chief.
There.
Back again for another episode. Just cool, man.
Yeah, as usual.
Alright, and tonight in the house, we have a special guest joining us from the Eastern Caribbean down there in Antigua. Consultant urologist, Dr. Adrian Rudd. Dr. Rudd, how are you doing?
I'm good. Thank you for having me here.
Welcome,
All is
Doc.
well. Thank you for having me.
Yeah, man, we hope you come back to your second home in short order, man.
I'm always there, don't worry. Like I
All
never
right.
left.
All right, for real. So before we take a deep dive into the topic, Andy, tell the people them what them can find, you know.
Yeah, man. So, guys, we are the Undiluted Corner on YouTube. Please like, share, comment. The channel is going on amazing. So, guys, we're just asking you again, please, just to like, share, and comment. We are also on Instagram at the_undiluted_corner. That's the_undiluted_corner. And also, please feel free to send us an email at the undilutedcorner, the number 7@gmail.com.
All right, and again, just tracking back to YouTube, please subscribe, hit the post notification bell
Ding.
so that you can know every time when a new episode is uploaded. All right.
sir.
So, Dr. Rudd, we want to kick it off by first starting out by asking you, urologist, what does a urologist do? So, explain it for the men. What's the
Good
role
question.
of a urologist in the medical profession?
All right. So as a urologist, I am a doctor, a medical doctor, and a surgeon specifically trained to treat diseases of the genitourinary system. And the genitourinary system is anything to do with the kidneys, the bladder, the prostate, the penis. Okay? Some people say that I deal with any system that urine touches. Okay?
Okay.
Because most of the issues I deal with have to do with the prostate, I end up seeing a lot of men. So I like to see myself as a men's health specialist.
Which is right, and it is great that you bring in a men health specialist to the Undiluted Corner, dedicated
So-
towards the improvement of men.
Correct. So not only am I into the medical side of things, I also do surgery. Okay. So I do things like removing kidneys, dealing with kidney stones. A lot of what I do is prostate cancer, men that can't pee, and of course, what we're here to talk about, raising the dead, erectile dysfunction. Very interesting
Brilliant.
topic. Very interesting topic, but because it's so taboo and so many people are afraid to talk about it, it doesn't get spoken about enough.
Indeed.
So, and I'm not even going each Sir Rod. I would like you just jump straight into it. What is erectile dysfunction? Because we hear the term often. I think some persons know what it is, but for just for everybody's sake,
Mm,
tell us exactly what it is.
nice. So, as a clinician, as a scientist, as a doctor, I'm going to be giving it to you as medically as possible. All right. There are lots of different ways to discuss it, and I want to kind of bridge the gap between the doctors, the clinicians, and the layperson. So, from a medical standpoint, erectile dysfunction is the inability to attain and maintain an erection for satisfactory sexual intercourse. All right. So, in this, and I'll go over that. You can't get it
Yes, please.
started.
Yeah.
You can't get it. You can't get it up, or you cannot get it up long enough, or you cannot keep it up long enough so that the sex is satisfactory. All right. And that is essentially what it means. And it has lots of different components of it. In the simplest fashion, when the layman hears erectile dysfunction, it just means you can't get it up. All right. But there are different
Yeah, raise the
elements.
dead.
You're correct. You can't raise the dead. No, there are
Yeah.
many different aspects of it and many different causes of it. All right. Um, in medicine, we generally start off with how significant is the problem? How many people are suffering from this, or what we call the epidemiology? Why are we talking about it? Is it worth it? And there are many ways to look at it. Now, first of all, men don't take care of their health. Men don't complain. Men don't talk about health. We get put at the bottom of the barrel when it comes to
Come
health.
on. And
Worse,
yes, yeah,
you
man.
start talking about your penis. Nobody want to hear about that. Nobody want to talk about if a man say I want to have more sex or better sex. Nobody care about us.
Yeah, yeah, yeah.
All
Yep.
right. But there are several ways to look at it. From a numbers standpoint, it's hard to tell because most people don't come out and talk about it. But the latest studies demonstrate about 40% in the age of 40s, 50% in the age of 50s, 60% in the age of 60s, and so on and so forth.
Yeah. Jesus, king.
So we do know that as men get older, just checking, I lost you for a sec. Everything is good?
Yeah, man.
Yeah, man.
Everything
Yeah, man.
good. Yeah.
Good. As men get older, the prevalence or the number of people with erectile dysfunction increases. So the older you get, you can almost see it as a function of age. However, there are a lot of things that we do in our early life, younger life, that can contribute to erectile dysfunction. Now, there are two ways to look at it. If you just look at it from the fact that, look here, a man can't get it up, I want to have more sex, nobody going to look at you. But the other way to look at it is the penis is a blood vessel, all right? And the same way that you will die from a heart attack, die from a stroke, die from kidney failure, is the same way the penis is a vessel that is being damaged. So what I like to do to tell patients or to tell people to get greater interest is that your penis is the first sign that something is wrong with your entire body. You understand? So if your penis is not working, if you can't raise the dead, other things are dying in you at the same time that may be more important. All right. So you worrying about raising the dead to have sex when you're a few weeks away from having a stroke. And when you put it into that context, people are willing to listen and take it into consideration.
All right, all right. Before we even go deeper into know the causes, because you're touching some critical areas, and before we touch on the medical and the non-medical, we want to ask: is there a difference between incontinence and erectile dysfunction, or impotence and erectile dysfunction?
Okay. Yes, indeed. So you mentioned three terms. You mentioned erectile dysfunction, impotence, and incontinence. All right. And feel free to ask any kind of question you like. I like this because remember, you're not a doctor. You did not spend the 15, 16 years to learn this. And things which sometimes us doctors think are second nature, you will never know. So please feel free. Impotence means that you're unable to get somebody pregnant. Okay, that's one of the words. You cannot be fertile. Erectile dysfunction means you cannot get it up.
I know that as well.
All right. you may not be able to get the penis up, but you have fertile sperm that you can get into somebody else if we took your sperm out medically. Make sense?
Doctor, I want you to repeat that again so
Yes,
that
please.
men
All
can
right.
really understand, because
All right.
in local Jamaica terms, most time when
They say
somebody say
impotent.
impotent, them
Yeah.
also believes is the same thing as just
As
being
as ED.
Very
as ED.
Yeah, yeah.
very similar. If you're impotent, you can't get somebody pregnant. All right? If you're impotent. So you can have good erections, but you cannot get somebody pregnant. It's almost the same as infertility.
Okay,
You
okay.
get me? So you can have good erections and can't get somebody pregnant. All right? You can be impotent where you have erectile dysfunction means you cannot get the penis up, and incontinence means you leak urine, you cannot hold your urine.
Okay, okay.
So you
You
can
get
get
the
the
difference?
penis up, but you can, but you're still leaking urine. You
You
can't.
leak
That is
is
more of a bladder problem.
exactly. Incontinence has to do with a urine problem, and it's not just a bladder problem, but that's a urine problem. When you're talking
Okay.
about impotence, you're talking about sperm. When you're talking about erectile function, you're talking about the penis. You
Okay.
understand? Clear?
Give thanks for the clarity,
You
Yeah,
get
man.
Doc.
the
Give thanks for
difference?
the clarity on that, doc.
So, for the purpose of what we're discussing here, we're talking about getting the penis up. All right. We're not talking about if you can get your partner fertile, because you may have a good functioning penis, firm and stiff, but you can't get your partner pregnant. You're impotent, but you're having good sex. Follow me
I guess
there?
we, yeah,
Yeah, man.
I guess we'll have you again, Doc, to explore
The
that
fertility issues
yeah.
another
Because the
time.
fertility is a whole different topic. That's another 2 hours we can talk about.
Yes,
All right.
man.
Yeah, man.
Mm. Yeah.
So I mean,
So you're letting that.
I guess the follow-up question I have to that Doc is
Mhm.
all right. A man now having problems raising the dead, right?
Yes.
What are the possible
All right.
causes of
Of
ED?
that. All right. So there are many, many causes of erectile dysfunction. All right. Um, how I like to break it down is you need three things to be functioning well to get good erections. One, the nerves. Two, the hormones. And three, the blood vessels. All right. The nerves, the hormones, and the blood vessels. All right. And if there's a major damage in any one of those three, it can lead to erectile dysfunction. All right. So part of my work is to find out from the men what is the problem and then to figure out what is the cause so that I can fix it. All right. Now, we started off by saying, first of all, most men don't want to talk about erectile dysfunction. All right. But if you do get a man to come by and start speaking about this and impress him, we have different questionnaires that we ask the men to get an idea of how bad it is, what it is, and how severe it is for them. Now, going back to the three issues, the commonest thing that we see in young men has to do with something we call psychogenic erectile dysfunction, or basically is your mind. You're stressed out, you have a new partner, you're thinking about something else, you're frustrated about something else, something just feels off, you feel guilty about what you're doing, and then your penis just doesn't work. That generally is the commonest type of erectile dysfunction, especially in young people. And what tends to in young men, and what tends to happen with this goes away by itself. From you tell the man, look, it's likely mental. You do all of your tests and everything come back normal. That just goes away on its own. Okay. But there are people that can have problems with the nerves itself controlling the penis. People can have spinal cord injuries. You have an injury to your back, injury to the spine, injury to the pelvis, or you have diseases that damage the nerves, the long-standing diabetes, things like syphilis, these things damage the nerves that control the penis. And if those go, your erections will go. Okay? Second big thing, so that's the nerves. The second common thing is your hormones. And we're seeing this a lot. The number one, the testosterone, the male testosterone, I suspect you know the male hormone. I gave you the answer. The male hormone is testosterone.
Testosterone, yeah.
Testosterone is very, very, very important for setting the environment for the cells in the penis to work. If your testosterone is low, it causes you to have low energy. It causes you to not want to have sex, low libido, and it causes you to have erectile dysfunction. So what we find is a lot of men, most men at age, as they get older, the testosterone level is going to go down. But what we're finding locally, globally, internationally, that testosterone levels are falling. No, there are a number of things which are proven, and there are a number of things which are suspected. So one, the soy products. Okay, the soy is notorious for taking testosterone and breaking it down to estrogen. That's the female one. Second thing, obesity. Fat. If you're carrying excess fat takes your testosterone and breaks it down into estrogen.
It look like me need to go in a gym.
Correct. So women have the fat, right? So fat takes the testosterone and breaks it down to estrogen. When men are carrying excess body fat around the tummy, that lowers our testosterone. So simple things like exercising and eating well will lower your body fat content and improve your testosterone. These things are harder to do, but when you tell people to exercise, nobody wants to exercise. They have every excuse. When you tell people to eat better, they say, oh, they can't, things too expensive, can't bother, can't, and these are the things that we have to do. So testosterone is very important. Now, globally, there are a lot of studies which are showing the testosterone levels in men are on a decline. Is it because of our lifestyle? We all believe so. Is it because of these things? Phone. Everybody have phone in their pockets with giving off radiation. Is it because we're not as active anymore? Back in the day, you'd have to walk up and down, you'd have to run, you'd have to hunt. Is it because of the things in the food that we're eating? We're eating more processed foods, exposed. So generally, throughout the world, testosterone levels are falling, and it is associated with reduction in fertility, the potency that we were talking about. All right. So I told you about the nerves. I've told you about the hormones. And then the other thing is the blood vessels. Now, the blood vessels are related to the same thing I was saying regarding heart attacks and strokes. You can imagine the blood vessels to the penis like little pipes. And if you have certain chronic illnesses which clog those pipes, you cannot get blood to the penis. So example, your high blood pressure, the diabetes, the high cholesterol, these are the three big bad boys, which unfortunately, you do not feel them until something bad happens, like a heart attack.
Repeat so the men can hear you again, Doc.
Yes,
the
please.
hypertension, the diabetes, the high cholesterol. Now, there have been lots of studies coming out, particularly in Jamaica, which show as many as 30 to 40% of the population are hypertensive and don't even know that. And there's quite a lot of data. So where I sit as a urologist and a men's health specialist, a lot of what I do is about promoting wellness, getting young men like yourself and myself to go and do those wellness checks, encourage you to start exercising, dieting, staying healthy before you get sick. And we're trying to change the narrative of what happens to young men and older men, because we can't reverse 20 years of bad life and bad living in 20 days.
Why, Doc, you're touching some very important points. I must say a lot of this I was totally ignorant to as well, which I know I'm going to have a lot more persons watching this and saying, yo, Jano, I never know that either. You know, so I mean, to the point you mentioned earlier, I guess us men, Ali, we have to take the health thing way more serious
Right. Right.
than what we thought. You know.
Yeah.
Yeah.
And something I like to tell all of my patients, men and even women as well, I say, look here, once a year, around the time of your birthday, go and get a wellness check. It doesn't have to be to a urologist, but to your general doctor. Let them check your sugar, check your pressure, check your cholesterol, pick up any other problem that you may have just once a year. Treat it as a gift to yourself. And specifically for the men, I say, look here, you service your vehicle how many times a year? 2, 3 times a year. Do you wait for your vehicle to break down before you carry it to the mechanic? Or you go and get it before?
Yeah.
So that usually resonates with them and gets them to see things the way I do. And I think it is changing significantly.
Yeah.
Brilliant, brilliant. That decent boy. That is serious. What I call serious public service. You know. Doc. So in Jamaica, we have a culture where, you know, our dancehall promote men performing long, going
Yep.
for long periods. You know. So a lot of young men, in particular, would take a lot of stimulus or different stimuli to keep it up for a very, very long period. Now, I want to ask you if any of these things can have an adverse impact on them that would cause erectile dysfunction.
Okay, so you've asked several questions, but it's a good question. So, yeah, man, the culture, wherever you are, most men want to stay long. First thing, from a science standpoint, you don't really have evidence as to what is long. And one person will say 1 minute is long, one person going to tell you 1 hour is long, one person going to tell you whole night is long. And a lot
So
of
maybe to help us to understand what is regular, you probably can tell us what is defined as premature ejaculation, because that probably will help a lot of guys who no believe so they are going long enough.
Very good question. Very good question. So there are 2 definitions of premature ejaculation. One was a very subjective definition, basically saying if you ejaculate faster than you particularly are satisfied with. And then one definition said within 60 seconds of entrance into the vagina. Okay? No, so that's a different topic. No, if men want to stay, at the end of the day, though, they looked at studies and it also dependent on the partner, because one man can go for 1 minute and very satisfied and think he's done his job and he don't want to go nowhere. One man will go for 5 minutes. Yeah. And then one partner may say, all right, the woman, one person's woman will say, look here, 5 minutes and I good, I don't want nothing more, and 5 minutes and you're in. Another partner is going to say, look, I want 2 and 3 rounds, I want a full hour. So it varies. A lot of it is dependent on the partner and the couple.
Yeah.
All right.
Yeah.
Now, if it is a man has premature ejaculation, there are several things that you can get. We're going on a different topic, but the different things that you can get the man to do. First of all, mind control, which distract yourself when you're having sex. Number 2, there are special what we call retardant creams, which are basically local anesthetic gels which can be rubbed directly on the penis or put inside the condom. And then number 3, we have some medications which can be used, which dull the sensation and improve the amount of time which a man spends within the vagina.
A lot of guys here, they use things like alcohol, to keep it up.
Yeah.
Yes. So I'm saying things like alcohol and so on. Will it has an adverse impact on your ability to keep to be erected?
Yes. So alcohol is an interesting topic. So alcohol is a central nervous system depressant. Okay. Basically, it turns down all stimulation. So small doses of alcohol will cause you to last long. And you always hear people talk about when they're on the Henny and all of that kind of thing, they're going for everything. That's literally what alcohol does. But no more than ever, the science is finding the harmful long-term effects of excessive alcohol. Now, about 20 years ago, or about 10 years ago, there was recommendation from the Heart Association that 1 to 2 glasses of alcohol per day, or 2 glasses in a man and 1 glass in a woman, is actually healthy. They've just dialed back on that and said, look here, no alcohol is healthy. So before they used to say, yeah, go and have a glass of wine. But now they're saying, if you don't drink, don't drink. If you do drink, don't go past that. But they're not saying that it is beneficial to your health. You get that? So long term, long-term alcohol gets broken down to ethanol. Ethanol damages the liver. And that is the number one thing it does. It damages the liver. It causes damage to the brain. It is addictive, so you can then become alcoholic, which then affects your nutrition, the nerves. So you don't want to be depending on alcohol for your sexual performance. All right, I hope that is pretty clear.
Man, that's pretty clear.
Right?
Glad you made that point as well, Doc. So
no, there are lots of stuff off label that people use in the street now. So many different names, stone,
Shiny brush.
yeah,
you can go on and on and on. The issue is, from a science standpoint, a lot of these things are not regulated. They have not been tried in clinical trials, and it is hard to know what they do. There are people that have studied these, and what they have found is that a lot of these contain small traces of things like Viagra, the PDE5 inhibitors, that class of drug which is known to cause erections and keep your erection up. So literally what these guys are doing is they're cheating with their product. They're not calling it a pharmaceutical drug, but they're putting small doses of it which don't fit the criteria for them to have to call it a pharmaceutical drug and selling it to the people. And that's essentially how those work.
so is that, I guess that's from a ethical standpoint or unethical standpoint.
Correct. And that is a problem. But because it is not regulated by the pharmacy councils or the FDAs, then they can sell it over the counter as long as the threshold is lower than they do sell it over the counter.
Okay. So and I'm glad they made that point as well, because I guess going to all right, those are over the counter stuff, but you may have drugs like antidepressant when if somebody is stressed.
Yeah.
What are the impacts of those medical aided stuff
All right.
on the body?
That is a very good question. So back to erectile dysfunction, because that's where we're staying. Because in terms of erectile dysfunction, men are having problems getting the penis up. There's a number of medications out there which you can be taking for other things which cause you to have erectile dysfunction. Very interestingly, some of the blood pressure medications can do it. All right. I would not go into the details on which ones, but occasionally you have young men who have hypertension. Doctors put them on the common stuff, and then they come back saying that the penis is not working. And this is a known thing where some young men, you put them on pressure medication and they're not going to take it because they heard that a friend of theirs is on a pressure medication and it stopped their erection.
Pressure get too low, doctor.
Well, it is not even about it being too low. How the medication works, it somewhat blocks the nerves that cause the erection.
Okay.
So then, but it was not designed for that. It was designed for pressure. So generally, once you are aware of it as a doctor or a urologist, you would switch the man from that medication to put them on a pressure medication that does not affect the erection, but controls their blood pressure.
So in a case like that, Doc, it's fixing one but causing another problem.
It can, correct. Because like I tell all of my patients, you see, every single drug you take has a side effect. I like to call drugs toxins with beneficial side effects. You fix one thing, it causes another problem. Nobody wants to take tablets. For me, tell somebody take a tablet, they give you every reason why they don't want to, and drugs trying to kill them. But there are beneficial effects. You have to just be aware of them, and to know why you're taking what you're taking and what is your long-term goal.
Okay.
Okay.
And oh, not to cut it down, but even on the other, well, on the big one, which is the Viagra,
Yeah.
um, I think there's also a misunderstanding out there as it relates to the use of the pill.
Yeah.
I mean, a lot of person, and they can just clear up this for the persons who are confused.
Yeah.
Um, well, my problem myself is also confused, but
Yeah.
I get the understanding that persons use the Viagra to, for some form of stimulant, right?
Yes.
But it was really made for the heart.
Correct. The heart and more for the lung. So how it works is that it causes blood vessels to dilate. Okay, meaning they open up, they get wide. So initially they were using it for people with certain heart conditions, and they want to affect the amount of blood going to the heart and the lungs, or to reduce it in the simplest fashion. And then they found out that they were giving it to these guys to fix this heart and lung problem, and the penis fly up in the air, and the men them were very happy. No, the issue with it though is that if you give this medication to men that have a failing heart or poor circulation to the heart or are close to having a heart attack, you'll basically take the blood that's going to the heart, keeping them alive, and put it in the penis, and in the heart. So that is
And then the heart will die.
exactly. So literally, that is what happens.
You rise the penis and kill the heart.
Correct. That is
That
literally.
sacrifice.
So exactly. So everyone has heard these stories about this older man has a young woman and takes all the Viagra and this, and go out on a weekend having sex, drop down dead. And that is a story that grips a lot of men in fear. Generally, before a man is put on these medications, they actually need to see a doctor and be screened to see how fit and strong the heart is for this sort of activity. If it is deemed that if you're a man that you have chest pain going up the stairs, you have shortness of breath going up the stairs, you're sitting down, and then your heart racing and so on, you may have a direct problem which contraindicates or makes Viagra and those type of drugs unsafe for you, and you should see your cardiologist. Because remember, as I said, if your penis is not working, it could be a sign of more serious problems in the other vessels, the heart or the brain, suggestive of a stroke. So that's that classic case. The problem you have though is, because a lot of these drugs have slipped into the black market or are sold over the counter for profit, you'll have people that don't know this, don't get checked, would purchase it, and then run up in problems.
Yeah, I was just about to make that point because you actually have those on the market. You can probably pull up to a man and say, "Yo,
Exactly.
blue pill."
Exactly. Everybody knows where they can get that, and if you take it and you're okay, is one thing. But if you're that unlucky person that had a problem and you take it, you can die.
All right, Doc. Very good. So we want to go in some non-medical ways now how a man can rise the dead.
Yes. So, unfortunately, the non-medical ways are all the boring, simple, easy stuff that everybody knows and make every excuse to not do it. Diet, exercise. Exercise means 4 days a week, at least for 45 minutes till you sweat. Just that alone, you ask how many people are doing exercise 4 days a week till they sweat. Most people going to tell you, no, can't, next time, used to, Jano, I'm supposed to, work, picnic, wife, traffic. And that is the first thing. If you are active, just that activity level helps to build muscle mass, push up testosterone, keep you healthy, keep all your vessels healthy, keep your testosterone up, keep your penis up. Very simple. How many people are doing it? Any of you exercise 4 days a week? I don't want to put you guys.
No, man, no one can put you on the spot, man. Doc. I don't do it.
Ali, Andy, do any of you exercise 4 days a week?
I don't.
Well, I do something, but not till I sweat.
See there.
So,
See there.
yeah, but you know that earlier you said which I was actually having a conversation with one of my brethren the other day, and that same example came up. You know,
Yeah.
when you were talking about, you know, the whole the effort you put in service in your car, you will take the entire day
See it
and
there?
service the car, make sure say you get the genuine parts.
You see it
You
there?
make sure say you use the proper oil, the shell,
Yep.
the arms oil. But then when you finish service your
Yeah.
car, you go buy a soda.
Exactly. No,
Yeah.
we're coming on to diet now. We're coming on to diet soon.
Yeah.
I don't want to bash
Full of
sodas, you know, you have to be
sulfate.
careful how you say things, but we shouldn't really be on sodas anymore, you know?
Yeah,
And we'll talk about that. We will talk about that. But exercise is very important, and especially where we're coming from as men, where we used to live active lifestyles where you had to move, you had to be physical to survive, you had to be physical to get things done. Now, we all have cars. It even get easier. You work from home. You don't even have to leave your home. You
yeah, yeah.
understand? It's
We have a
so
lot of delivery couriers now, the Uber.
yeah. You don't even have to drive yourself. Like life is getting so easy
Yeah.
physically to our detriment. So you take away before people never used to have to think about going to exercise because you had an active life. Now that life is so inactive, you have to now prioritize moving. And by exercise, whatever you feel to do. Do you like to kick football? You like basketball? Do you swim? Do you jog? Do you skip? Do you do calisthenics at home? Do you have do you go to the gym to lift weights? You do what works for you because any movement is better than no movement. You
Yeah.
understand?
Yep.
There's
Yep.
literally no excuse nowadays. You sit down in your room, do 30 push-ups, 30 sit-ups, and 30 squats. Buy a skipping rope. That don't cost no money.
Yeah.
And
Yeah.
skip
Yeah.
it. You understand? 20 minutes of skipping. This is how you have to start looking at it. It pays off in the long run.
Yep. Yep.
The,
Yep.
the next topic you touched on, as you brought up soda, is
Yeah.
that diet. No, I believe diet is the single most important thing that we can do to stay healthy. All right. No, we exist in a world where food is no longer about nutrition. Food is about profits and convenience, and this is just what people wanted, and now we are reaping the side effects of that. Okay. Now, in terms of food, there are three things that you have to watch out for: the added sugars, right? The salt, and the cholesterol. Three big boys, and I think
Added
every
sugars, the salt,
and the
and the
cholesterol.
cholesterol.
Yes,
So in terms of the added sugars,
yes.
should I take it to mean that these are the artificial sweeteners you're talking about here?
Both the artificial and the natural sweeteners, and I'll tell you why. Your sugar content is very important. All right. When you buy any juice, whether you buy any, take sugar, white sugar, brown sugar, honey, these are all added sugars. I don't know if you have learned to read labels where you pick up a soda and look at the RDA, the percent on the back of it. Are you familiar with reading it?
Yeah.
Yes,
Yeah.
man.
So, for a classic example, something like a malt beverage, I will not call one type of malt or so on. How it is made, one bottle of malt can have up to 70% of your sugar content for the day. All right. We grew up thinking that this is a healthy drink, this packed full of vitamins and energy and nutrients. So you drink that with your lunch, you drink that with your dinner, and the sugar is harming us. That sugar your body has trouble breaking down, it stress out your pancreas, it ends up getting converted to fat long term. All right. So added sugars, we need to get to the point where our sugar comes from natural sources, meaning fruits, where fruit plus water equal juice. A juice, a drink, is literally a lot of sweetener, a little bit of flavoring, and water. But this is how we grew up. And certain things trigger the brain and give you this endorphin rush, particularly sugars, particularly salts, and we're all hooked on salts and sugars, and that is what is harming us. So the world is now waking up to the harms of added sugars. You see, the governments are all looking at this sugar tax. Everybody trying to give you a low sugar alternative, a low sugar version, because we need to protect ourselves. So if you're a soda man, by now, literally, you should just be drinking water, 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 and a fruit. No, nothing in life is absolute. If you touch a soda here and there, but just understand what you're doing. But if you drink one ginger ale is 80% of your sugar intake for the day. Can you imagine if you drink soda with each one of your meals? You get 300% of your sugar content in one day. And if that is your lifestyle every day, for the week, for the month, what are you setting up yourself for the future? So if you live like this from 18 to 40 and your penis not working, are you surprised?
You shouldn't be.
Exactly. So it's when I break it down, like, I know you're going to come to me after you doing this for 20 years and tell me, fix it now, fix it today, fix it tomorrow. How are you going to do that?
Fix again.
So it's a work in progress. Education is key. You understand?
Which is why we're glad you're on the program today. That boy, I tell you wouldn't understand. Trust me.
All right. So that's sugar. The next issue is salt. All right. Now, the salt helps the body retain excess fluid and drives up your blood pressure, and that leads to damage to your vessels, the blood vessels. So how you can imagine it is like if your heart is now pumping too hard, it damages the pipes, and that's how your blood vessels get damaged, and when they damage, they narrow off in a simple fashion. Apparently, Black people and Caribbean blacks, through a very long, complicated theory, are more sensitive to salt, meaning salt kills us more disproportionately than white people. All right? What is our national dish?
Ackee and saltfish,
man.
All right. So you catch your ring. So it is believed that when we were slaves coming over, if your body was able to keep salt kept water, and water kept you alive if you were short on water. So if they put you in a ship and you can't get any water, but your body is able to retain the salt, it would also retain the water and keep you alive. And the man them that couldn't do that died. So all of us are descendants of people that are very sensitive to salt. We keep the salt in and we keep the water in. But by doing that, it drives up your blood pressure. And by driving up your blood pressure, it sets you up for heart attack, it sets you up for stroke, it sets you up for erectile dysfunction. So with that belief, we more than ever have to be a little more cautious of the type of salt and what we put into our bodies when it comes to salt. National dish is salt. All the fast foods is salt. We season our food, the jerks, full of salt. The KFC, salt, pepper. Salt does something to your brain, pleasure. Some people all put salt on their fruits. People get their food, sit down at the table, take up the salt shaker, add salt in it. These things are hurting us, hurting our penises. So if you doing this from you're a child, from as long as you can start shake out your salt, and now you coming to me at age 50 and say this not working, fix it.
So even the snacks that we give in to our young boys.
Once again, you pick up all of these snacks, your chips, I don't want to call the names and the brands, but you just pick up the packet and look at the salt content. A lot of the times, one little packet contains 25% of your salt intake. Little packet.
So that I kind of glad you mentioned that. So probably it's not for this conversation, but since you're on it still.
Yeah.
When you look at the label, right?
Yeah.
The label has grams.
Good.
It has percentage.
Good.
First of all, I want to understand what the gram stands for, and then what the percentage stands for.
Very good. That is a very good question. So sometimes they put the grams, right? And sometimes they put how much grams in one serving and then tell you what a serving should be. So sometimes in a whole box may have 5 servings. And they'll tell you in one serving, you have X number of grams. But if you go and eat the whole box in one sitting, you end up getting 5 servings or 5 times how much is in that.
Whoa.
And then they may sometimes put how much grams in that box. So you know. Now the percentage is something they call percentage of the recommended daily allowance. So if you don't understand the grams, not a problem. But the percentage is how much they work out, how much they recommend you of this nutrient you're supposed to get for the day, and they tell you how much percent is in it. Sometimes they say how much percent is in that serving. So then you have to know how many servings. Because
sometimes that one serving you can get for the day, but some people would consume 3 or 4.
Exactly. Some of the very common drinks we drink, one bottle would have 1.5. Some of them even have 2 servings. So you have to remember to double.
So like you know, the security guard now, who work sometimes 12-hour shifts, and even the doctors as well. I notice a lot of doctors even got 24 hours, and then the doctor would drink some energy drink.
I used to be one of those. I know exactly what I mean. Some of the tall energy drinks,
yes, man,
2 and 2.5 servings in that, and you drink that on one shift.
One go,
You drink that and you fly. You drink it for the caffeine. But when you look at the sugars, it have 60% of your daily recommended allowance in one serving, and you just drink off 2.5 servings.
So just to confirm that. The percentage is saying this is the daily percentage you should.
The daily percentage.
Okay.
So this is telling you out of the day, out of the whole day, this drink will have 60% of what we recommended for one day. Or this may say this drink may have 20% of what is recommended for the day. So you have to know how to interpret it. And the crazy thing is, this thing is right in plain sight for everybody to see.
Yeah.
Understand it. And you guys are intelligent university graduates, and you never stop to pray it and say, "Yo,
think about it." Yeah.
Imagine the people that don't reach that level. You understand? But this is where knowledge is. This is what I do. I am interested in preventing. I'm interested in treating diseases, and now I'm even more interested in wellness, preventing you from getting those diseases. That is where we're going.
Yeah, and again, just to kind of follow on that point as well, that the salt and the sugar intake, right?
Yeah.
Is there like a limit or a set amount that you should actually take for a specific day or any particular day?
I don't have the numbers in my head, but the numbers are, they usually see the nutritionists or the dietitians. They will tell you exactly what it is. And it also varies from person to person depending on activity level, what your medical illnesses are, what medications you're taking. So it varies. But the simplest thing is a balanced diet. Now, in terms of portions, in terms of what you're eating, another thing I want to bring up. When you have your plate, right? We all grew up where you want your whole plate full of rice.
Yeah.
On top of the rice, meat. And a sprinkle of color, just a little salt bay. Remember, that's how we grow. So we grow. But what your plate should be, 50% of your plate should be the colors, the vegetables. 1/4 is starch, and 1/4 is meat. That is how your plate should look. The vegetables keep you healthy. Starch for energy and protein, because we grew up in a very starch-rich culture. Love rice and peas. What you had for breakfast this morning?
The breakfast heavy, you know. Some
Tell me. What you had? Tell me. Listen to me.
Yam, banana.
Yam, banana, starch. See it there? Which dumpling you had? What exactly? But that's just how we grow.
Yeah.
So
No vegetable.
not one piece of vegetable with that. When you get your rice and peas and stew chicken, you're lucky if you get some cabbage, a little shred of
Yeah,
carrot,
shredded by the
Just
side.
yeah,
a
sure.
little piece of carrot on the side.
Yeah.
You know?
Yeah, doc. So you was going to go on to the cholesterol.
Yes. So the third thing now is the
You know.
cholesterol. Now, in the simplest fashion, the cholesterol clogs your arteries. All right. Now, we exist in a very cholesterol-rich culture. Eggs, right? Fast food, the butter, the oil, the fat. We love the fried food, the fried chicken, the French fries, shrimp, lobster, very rich in cholesterol. Patty, very high in cholesterol. If you're eating those on a regular basis, eating out, because the thing is, the oils is what make the food taste good. The oils make you come back and spend your money. You
The
understand?
trans fat.
The transfer. From you tell people grill the food, steam the food, bake the food, everybody start grumble. Fried chicken, yeah man, everybody there.
Yeah.
You know? So these are just the things. So it's a thing that you don't have to cut these things out absolutely, but you have to be aware about the knock-on effect on your health. So if you're eating clean all the time and you touch this here and there, not a problem. But you have to know what these things are doing to your body.
Well said.
Yeah, doc. So one use now the medical. So we're moving on now to the medical treatment now.
Yes.
Because the boy believe you me. You know, a lot of time the doctor heal the sick.
Yeah.
But in this case, the doctor will have to help to raise the dead. So
Very good.
in this case now, what we do medically?
So we move through the lifestyle stuff. That is first level. We've touched on the tablets, the drugs, the class of drugs, the PDE5 inhibitors, which essentially redirect blood to the penis. When that doesn't work, there's another step up, which then requires injections into the penis. There are certain agents which cause the blood vessels in the penis to dilate and swell, and we can actually give them to patients to inject in their penis, and then they get an erection, sometimes use a pump and a ring, and that solves the problem for some men. Okay, the issue is you have to get comfortable with injecting your penis. There are also a few other agents which you can just insert down the penis, like gels and creams, and that helps as well. Okay. Now, there's another little gray area where there's injections of other treatments like stem cells and PRP. You may see on the news this thing they call the P shot, where they literally take out your plasma, take out your own blood, spin it down, and get the platelets and the stem cells, which you then inject back into the penis. The thinking is you're literally putting these baby stem cells back into the penis to say, hey, life has started over again. Let me regenerate the penis. Rebirth. And that has been a hot topic, which it works very, very well for some people. For other people, it doesn't work. That injection you do probably once, maybe twice a year. The issue with that is after that level up, the next level up is penile implants, where you actually do a surgery where you open the penis and put in cylinders, which you then have a pump, and when you have a pump hidden in your scrotum in the balls, and when you press it, the erection comes up, and when you no longer need it, you press it and it goes down.
That sounds like a whole pipe in fish.
There you go. Exactly. For some people, you laugh, but for some people that works really, really well and solves the problem. Obviously, it's a surgery, is a cost, and then you have to look at accessibility, where you can do that, where you can get that, and the issues.
So the risk as well,
and
because there must be some risk.
Yes. So those are generally the options for men when they have erectile dysfunction from a medical standpoint. All right. So that is where we are.
So I mean, long and short of it, that there are fixes to it.
Yes.
However, based on what we've discussed so far, we can actually put things in place so we don't reach
Correct.
that.
Correct. Fixes are there, and it's a general principle in health. There's so many different treatments. When patients come and they complain, oh, why this costs so much, why I have to do this? Well, if you did this the wrong way for so long, these are the only options. So yes, I preach the options, but I'm also preaching the prevention. That is where we're going. We're now trying to get you to live fulfilling, healthy lives. I'm trying to empower men, I'm trying to empower patients to take their health into their own hands and to take care of themselves.
All right, very great, Doc. So we're going to wrap up shortly, Doc. But importantly, normally with the erectile dysfunction, and I want you to talk now directly to the women out there. Sometimes women, a man and a woman, they're in a very happy relationship.
Yeah.
But the penis is not working.
Very
right?
good. Yeah.
So the woman sometimes believe that the man no longer finds her attractive.
Yeah.
And you spoke earlier about the psychogenic
Yeah.
impact.
Yeah.
But in many instances, not that the man no longer finds her attractive.
Yeah.
It's just that boy maybe him lack sleep, maybe he's stressed at work, or maybe his diet need to change or something. But he may be okay. What do you tell that woman? Now, what would you say to that woman now?
So remember, sex has to do with the physical, the mental, emotional, and sex is a couple. All right.
Yes.
The woman wants to have satisfactory sex. She has to be willing to be patient, communicate with her partner, let them know let her partner, let him know what the needs are, what the issues are. The man should feel comfortable to open up and say what he is feeling. And the woman should at least try to be patient, because sex is about two people pleasing each other. It can't be a one-sided thing.
Yep.
Very importantly, ideally that consultation should take place with both partners. Men that are on Viagra, that's another thing. The Viagra is a Cialis, and so you don't just pop the pill and it shoots up. It still requires stimulation. It still requires, hand stimulation, oral stimulation to get the penis firm. So these are all things the partner has to understand. If a woman knows her partner has erectile dysfunction, this is a medical condition. This is not a made-up thing. So same way somebody has diabetes, somebody can have sickle cell, and you have to understand there's a medical condition. Erectile dysfunction is the same thing. And at the end of the day, they both want the same thing. They want to have a good sexual encounter. If the woman now starts putting pressure, shaming the man, dissing the man, it then starts to get to his mental, gets to his mind. And every time he goes to this partner, he starts thinking, oh no, I'm going to do this, I may not perform, what is going to happen? Then it sets you up on this vicious spiral where when you have to see this partner, you start to think about things, and you just can't perform. And where you find the difference is when you go to see somebody else and it works completely perfectly, and then you realize, look, this is what it is.
So I mean, as with everything, and I always say to Ali, most of our problems, especially when it comes down to relationship, the basis of it is the communication. So you have a partner where, as you say, if you mention something like that to her, it come out, she may bring it off as, shaming you, or you're not so vulnerable enough to share stuff like that with her. Then that's a communication issue where just going to be a problem at the end of the day.
Correct.
So, yeah.
Yeah, man, Doc. So, Doc,
yeah,
I think we covered all the bases that we needed to have covered.
Great.
Very lively, very robust.
Yeah, very informative.
And I think a lot of men will be in a better place after watching this episode of the Undiluted Corner. You were very undiluted, Doc.
Right.
I mean, I personally learned a lot.
Yeah, man.
Yeah.
And I am sure, boy, Doc, I'm going to take the dieting and the exercising
please
more serious
please
before I have to come to you when my dead need to be resurrected.
No problem.
So Doc, it was a great one, and we're looking. We will definitely keep the lines of communication open because we need to come back and deal with the fertility and the premature ejaculation
Definitely.
at some point.
All right,
Right, so
then just let
we're
me
going
know.
to keep the channel of communication open.
Sure.
Doc, it was a pleasure.
Thank you for having
Very
me.
informative, man.
All
And I
right.
can trust me. I know a lot of the people watching it going to say the same as well. It was an absolute pleasure, man.
Thank you. Thank you.
So Doc, you have a when you're not in Antigua, you have a practice in Jamaica.
You know, I still see Jamaican patients
Okay,
online.
because I wanted to ask you, where can people who would need your service find you if they
It's
want
online via MD Link. For now, my Jamaican patients I see via MD Link. That's the telemedicine platform.
MD Link? Then
Yeah,
MD
the
Link.
mdlink.com.
Okay.
You'll see the ads all over Jamaica. If you're driving through, you may see these ads all over Kingston corporate area. And I see quite a number of patients there using that. I'm registered to practice and everything in Jamaica, so I send prescriptions to the pharmacy and I help out who I can. And I do have my colleagues on the ground that if it needs to be physical, I can send you to.
Very great, Doc.
Great stuff, Doc.
So Andy, before we wrap up,
Yeah.
great one.
Yeah, man.
Tell the people them where them can find we again.
So
And
guys,
ensure say them can get the solutions to the ED so the
Yeah,
dead,
man.
like let God rise up Lazarus. The dead.
I expect you to
can
say that from Marlin. But guys,
Take
we
care.
are on YouTube at the Undiluted Corner. Again, like, share, comment on the content. We are also on Instagram at the undiluted corner. That's the undiluted corner. And also, please feel free to send us an email at the undilutedcorner, the number 7 at gmail.com.
Raw truth, real
Real
conversations. Dr. Rob,
Doc,
blessings.
Thank you.
yourself.
Take care.
Oh.
Thanks for joining us in the Undiluted Corner, where insights abound and perspectives are born. Relationships, health, and wealth, we've explored them all. Until next time, let's continue to stand tall. Subscribe, share, and keep the conversation alive in the Undiluted Corner, where truth thrive until we meet again. Let's keep our hearts light. The Undiluted Corner, shining ever so bright.